enforcement of the HIPAA Privacy Rule. The OCR enforces HIPAA Privacy Rule, which protects the privacy of individually identifiable health information. The HIPAA Security Rule, which also sets national standards for the security of the electronic protected health information, and the confidentiality provision of the Patient Safety Rule, which protects identifiable information being used to analyze patient safety events and improve patient safety. So right now, Bernie, you can.
Hi.
Director Rodriguez, thank you.
Thanks for being with us today.
Great to be here.
I know there are lots of questions from the audience because they've been asking a lot of issues that have to do with OCR. So they're probably very happy to see you. And so the first question I wanted to ask you is about the privacy rule and where that stands now, especially in connection with business associates and your jurisdiction over that.
So as everybody knows, under the high-tech statute, we were required to issue rules that would address our new enforcement penalties, that would address breach notification, and that in particular would address the imposition of most of the privacy and security requirements directly on business associates as opposed to through business associate agreements. As we speak, the breach notification rule is in effect as an interim final rule, and the enforcement rule is in effect as an interim final rule. We now have pending before the Office of Management Budget what we refer to as the Omnibus rule, which captures those three issues as well as a number of other issues. And we, like you, are eagerly awaiting its issuance, and we're hoping we're going to be that it's going to be issued soon.
Soon. No ETA?
No specific ETA, no.
Okay. All right. Well, I'm wondering what is the biggest challenge for you as enforcement in chief in terms of enforcing the privacy rules?
Well, there's a number of challenges. I think the biggest challenge is transforming our organizational culture to an enforcement-oriented culture. And so right up until about 3 years ago, our primary model of enforcement would be to conduct an investigation very narrowly focused on the specific violations that were alleged typically by a patient, and then to seek correction of that narrow set of issues from whatever covered entity was being investigated. That's great. And we still, in 95% of our cases, do exactly that, and that's important. Both high-tech and the fact that the HIPAA statute and regulations have been around for so long really now call on us to do something far broader focused than that. And so we've now moved into an area of more assertive enforcement. And so we've seen, as the last 3 or so years have gone on, each year we have more and more monetary settlements, and we've seen a broader variety of agencies being subjects of those settlements. So we've now seen a physician's practice be subject of the settlements. We've seen a couple hospitals. We've seen health plans. We've seen a state social services agency. That's critical because any single one of those cases is a message to the rest of the industry. That especially the way we're doing it now, where we're very clear about what were the particular violations that a covered entity had engaged in, that's a roadmap to the rest of the industry. These are the important areas that we focus on. These are the areas that you need to focus on as a compliance and risk avoidance matter. So taking an agency that was sort of busy doing all this corrective action and sort of moving it now to this new framework is probably one of my most important jobs. And I'm a former prosecutor, so that's kind of my bread and butter, is doing that kind of enforcement, is turning it around in this direction, but at the same time, doing it in a balanced and thoughtful way that is also coupled with real education. So just yesterday, I spoke at an Office of the National Coordinator event where we were rolling out our mobile security device tool. And that's something, especially for a lot of smaller healthcare providers, mobile devices are becoming a really important part of how they conduct their business. So striking that balance is another really important challenge for us.
I think it's interesting that you mentioned being a prosecutor, and I know that you were prosecuting for both federal and state government for 13 years a while ago.
Yes.
And I'm wondering how that informs your work today. You sort of touched on it a little bit, but.
Well, and I would point out that that I was a prosecutor, and then I actually became a private practitioner who represented healthcare providers, and then became general counsel for the county where I live that was actually a covered entity. So I've kind of seen that issue from a few different sides that really inform what I do as director. On the one hand, I think enforcement really matters. I think enforcement does breed compliance. But the lesson from the latter two jobs is that enforcement also needs to be mindful of business reality. And so we need to strike that balance between, clearly sending a message that we expect compliance, and we expect compliance because the patients expect compliance. In order for the whole electronic health record enterprise to succeed, there has to be bedrock patient trust in that enterprise, and we're part of the process of engendering that trust, but at the same time we need to balance that against business reality, and also we need to be clear as to what our enforcement priorities are, what our expectations are, and so it's really striking that balance that we're talking about.
And I'm wondering if you have a sense, you must have a sense, of what piece of the privacy rule, the regulations, kind of don't make it to the consumers. I don't mean consumer, I mean the healthcare organizations, the piece that they may forget about or have trouble meeting.
Well, I think that the biggest thing that often is missed is the idea that we are not prescribing a particular technological or administrative solution to the whole challenge of privacy and security. What we're prescribing in the rule and what we're looking for in our investigations is adherence to a process that's clearly laid out in the regulations. So great example. We were meeting with the KPMG auditors who are conducting our audit pilot for this year, which will then become sort of the platform upon which we'll have a permanent audit program. And one of their most significant security rule findings that cut across a number of different kinds of providers, but interestingly, particularly serious among relatively smaller healthcare providers, was the failure to have conducted a risk analysis, which incidentally finds its parallel in the findings we make in our monetary settlement cases. So that's a fundamental exercise that the security rule requires of covered entities, yet either the analysis wasn't conducted at all, or the analysis hadn't been updated in a long time, or the analysis was sort of woefully and clearly incomplete. So we weren't looking at the content of the analysis per se, we're just looking at, did you look at your entire business process, did you do it consistently, did you assess the risks, and did you act on the basis of that assessment? So that idea that it is a process that the rule requires is, I think, the main thing that we need to get out there. Similarly, I think you'll hear us say, and you'll certainly hear the Office of the National Coordinator say, encrypt, 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 right? Because it is absolutely the most reliable way to, one, avoid having to make breach notification. Two, it's the most reliable way to protect electronic health information. We had a very interesting finding in the audit, which was, and this is an addressable requirement under the security rule, which means it is a requirement, but if you conduct an analysis and find an alternative, that alternative is okay as long as it sort of mitigates your risks. What we found was basically two categories: people who encrypted and people who failed to conduct the analysis altogether. In other words, they didn't encrypt and they didn't identify an alternative method of protecting the information. So again, that goes to, it's a failure to engage in a particular process rather than the utilization of a particular technological solution.
Now, this is a question that may be better asked of many healthcare organizations, but I'm going to ask you, why is it so difficult? Because it seems like there are so many organizations that haven't done their risk analysis or having trouble getting it done. Why do you think it's been so difficult?
I mean, I think there's a few reasons, and I think we have to go back to, you know, you had asked me sort of my experience as a prosecutor. I grew up in particular as a healthcare fraud prosecutor. And, you know, the way the world was from, say, 1996 to a few years after I started as a defense lawyer, there was really intense consciousness in the health industry about fraud and abuse compliance where that consciousness had been absent before. And so there were significant investments being made in hiring strong compliance officers, not only creating compliance plans, but really living by those compliance plans. That's where we're starting to get now in the area of privacy. A lot of larger organizations have gotten there because they sort of had the experience with fraud and abuse, and so they basically brought that same mindset to privacy. But for a lot of other kinds of organizations, there's still a lot of a curve, and in part because you have to make decisions about where are you going to direct management attention, where are you going to direct management resources, and it hasn't gotten all the way yet. There's been some real progress made. I don't want to deny the progress, but there's still a long way to go.
And what about the consumer, the patient? Do you think there's an awareness and a real desire on the part of the patient? I understand there are organizations that are patient advocacy organizations, right. But do you think the everyday consumer patient understands their privacy rights?
Well, I'll tell you an interesting thing, and you look at our workload. Our workload, I think, you know, because our traditional sort of work until HIPAA came along was traditional civil rights work and anti-discrimination provisions related to national origin, race, disability. Our workload maybe quintupled over the years since the privacy rule came along. So I think there really is a consciousness on the part of patients and certainly an interest in the privacy of their health information. The challenge from a patient perspective is you're sort of looking through a pinhole as a patient. So all you know is you don't like the particular way in which your health information was used. You don't like who was told about it. You don't like the way that it was used. What you don't see is everything that's behind that. In terms of the risk analysis, the policies and procedures, the training and all that. And that's where we really have to come in, and that's also where all the folks dedicated to compliance need to come in, is to focus on all the stuff that the patients don't see, but that makes all the difference in whether an inappropriate disclosure actually occurs.
How many people are on your team working on?
So we have nationwide approximately 237 employees. About 1/3 of those, two-thirds of those employees are in our 10 HHS regions. So that's here in Boston. In fact, my Boston regional manager and deputy regional manager are out there somewhere if they want to raise their hands. Susan Rhodes and Peter Chan, we do a great job. Boston, New York, Philadelphia with a satellite in DC, Atlanta, Dallas, Chicago, Seattle, San Francisco, and Denver, Kansas City. So that we operate our enforcement efforts out of those regional offices. That's where our investigators are located. And those offices balance both the traditional civil rights caseload and the privacy caseload. We then, at headquarters in Washington, have dedicated subject matter expert teams, about 15 each between privacy and traditional civil rights, that write our regulations, write our guidances, provide subject matter support to the field, and the rest is basically administrative support.
So do you investigate complaints that come to you, but do you do other types of investigations as well?
We do. That's a very very important question at this particular time. So our traditional model of investigation, and most of what we do is, as you described, sort of responding to complaints. We are working in many different ways to move beyond that reactive model. And so, among other things, the audit pilot, we audited 115 entities in calendar 2012, is now taking us to a randomly selected group of covered entities and really doing a very risk-based audit of those entities, looking at the particular elements of the privacy and security rules where we think there's particular risk of a resulting breach and conducting an audit on that basis. That's a very different kind of approach to enforcement than what we were doing before, and we're also doing parallel efforts on our traditional civil rights side.
So more proactive. So you've already told the audience or suggested encryption is one key thing that they can do to help secure the data. Do you have any other advice in terms of keeping data secure?
People. I think that's the other big thing, is focusing on people. If you look at, and I'll bet you 3/4 of the folks in this room have, looked at the information about the breach notifications that we've received. And we've received probably to date, since we started taking in breach notifications about the last 3 years, about 500 large breaches. That's greater than 500 records compromised. The overwhelming majority of those breaches come in 3 areas: theft, loss, unauthorized disclosure. So in other words, not so much hacking, not so much even people breaking into a physician's office and taking information out. Instead, there's basically some human frailty.
Tom Moran from Concord Hospital, Concord, New Hampshire. Our neighboring hospital was one of the lucky random audit winners from this summer. And they described a process in which they had, I think between OCR and KPMG, 5 resources for 5 days on site without sort of a for-cause review, just as part of the random audit exercise. The folks at our facility, having heard that, say that's more people than show up for the Joint Commission when we get our review from them. Can you describe whether there's any thought process or rationale behind what level of resources? Because certainly you bring a big enough microscope into any facility, you'll find something.
Yeah. So I think the key is to understand that this, and this goes to my earlier response, I think, to your question. We were doing a pilot here. So we looked at a pretty broad map of compliance areas. Whether, I don't know. I mean, I think that's what we're trying to go to school on now, is that what our future audits are going to look like? Or to take your point, is 5 days with multiple auditors, is that level of investment too much, and can we be more targeted and more strategic? That's what we're going to school on right now, is to ask ourselves exactly the question that you just posed.
Hi, my name is Will Walser, and I'm from Jefferson Center for Mental Health outside of Denver, Colorado, and I have a comment and a question. First, we're one of the lucky people to be on the wall of shame, but to answer a question, we did not get a fine because we had our policies and procedures in place for our privacy breach, and we felt very lucky, I must say. But we have a fantastic privacy officer also. So we're one of them that didn't get a fine. My question is, you mentioned that you're working with the vendors. Are you working with the payers? I have a situation where I have several payers that have secure portals where I send data to, but they ask me to do modem transmission.
Interesting. See me after. Don't name them just now. So, I mean, I think we're working with them in the way that we are working with you right now, in the sense that we are not missing opportunities to get out and educate the industry. And by the way, thank you for that great example. You know, bad things will happen, breaches will happen, but at the end of the day, are we going to look at, was everything done possible to prevent that breach from happening? And by the way, you will not hear me, except in quotations, use the phrase wall of shame, because that is not the purpose of the breach notification program. The purpose of the breach notification program is to identify breaches, look for the vulnerabilities, remedy the vulnerabilities, and for us then to have the benefit of that predictive analytic database and saying, these were our vulnerabilities, this is where we need to be directing our attention. That is the purpose of the breach notification program, not to shame, not from my perspective anyway, not to shame entities. But that's interesting that payer issue is sitting out there. So I think that's something we will direct some attention to.
Okay, we're going to take this one last question.
Great, thanks. Good
and
afternoon.
Wrap it up.
My name's Dan Walsh. I'm from South Shore Hospital in Weymouth, Mass. And I also want to echo thanks for your being here today. Some very useful information. Based on your audit findings, especially through the KPMG pilot, and also, you know, the 500 reviews that you've processed, are you seeing from an org theory perspective or from a sort of an organizational view, what organizations that tend to be more compliant than others, how they may have more effectively positioned their security organizations?
We're actually, it's a very timely question because we learned some things in particular in the audit exercise about some not necessarily best practices but preferred practices. But let me also import from my fraud and abuse program, from my fraud and abuse background, and it, at the end of the day, comes down to leadership. And leadership owning compliance issues and doing so consistently. That is the thing that separates compliant entities from ultimately non-compliant entities. More than any other issue, resources, technology, it's that leadership that makes all the difference.
Great, thank you very much.
Thank you.
Very good.